A very warm welcome to Kaira Talks, Dr. Ankita Luthra. Here we talk about various trending topics from your daily life and thus make it easier for each one out of you there to deal with them consciously and practically. Today's topic is mental health. How to take care of your mental health post pandemic when life is going back to the normal, where you are going outside, attending the offices, mixing with people. How exactly it is so important to take care of your mental health as well. So, Dr. Ankita, how are you?
I'm good, Sujata. How are you?
I am good too. How are you finding this, life going back to the normal, which was earlier there before the pandemic hit India?
It's very good, to come back to the normal life, normal routine that we already had. And it's been long we lived that life before this COVID era. So it actually feels good once again, even though we had to wait for so many months to, get this life back to normal. And it's still, we're still struggling through it. And also, I would like to say there are so many people, who are actually not going to have that normal life back again because of this COVID-19 impact. So, and especially when we talk about the mental health. So, there are unfortunate minority of people, you can say like 10 to 15% of people who are going to not have that normal life back again, like the lucky ones, like we are having it. And that's very unfortunate to say, but yes, there are certain minority of people who are going to have a very different life, especially if we talk about the mental health. So today we are going to discuss all about that mental health aspect of COVID-19, and especially, once the lockdown is over, so we'll be discussing about that today.
Absolutely. So when you talk, when you say, when you use the word mental health, what exactly do you mean by mental health?
Yeah, so mental health and well-being is something which cannot be seen physically. It is something which is felt. It is all about our thought patterns, our the way we think, the way we act, the way we feel, our emotions, our beliefs which are there inside our mind. So that is all about mental health. So it's not, there's no vaccine to cure it, like the vaccine trials that are going for COVID-19 these days. So to cure us physically, but then if we talk about the mental health, there's no vaccine for it. And mental health is all about how you process your thoughts, your feelings, your emotions. So that's what mental health is all about.
Okay, so when you say that there is no medicine, how do we take care of it, and why is it so important for each one of us to take care of your mental health? What signs should we look out for? Because there are so many people out there who doesn't even know what the other person is suffering from because it's all inside. You don't show the signs, but still there must be some signs that we all should look out for in each one of our friends, family members to help them cope this, mental trauma or mental depression, the
Right,
mental
right.
health
So,
conditions that you're talking about.
yes, yes. So, like we all now know what are the symptoms, physical symptoms for COVID-19. We all are very much aware of that. But we are not much aware of the mental health symptoms that, occur simultaneously due to maybe any pandemic or even during a normal mental disorder. So, there are few symptoms which are related to COVID-19 and which are impacting us mentally. So, like one of them is depression, and depression is not just since we had COVID-19, it has been there long before, also before this pandemic era. But depression nowadays is very common because we have gone through so much mentally and emotionally during this COVID-19 lockdown and pandemic. So, depression is one sign. And if we talk about the sub symptoms of depression, then the very common signs and symptoms that we see is lack of appetite. A person doesn't feel the need to eat at regular times, like we normally feel to have the urge to have food and hunger. The second thing is loss of sleep, which is known as insomnia. So when our basic patterns of eating and sleeping they get disturbed, that means you are mentally not well. So these two are the very common signs. Then another thing which occurs as a sign for mental disturbance is anxiety. So anxiety is something which we suffer normally also, not because of pandemic only, but otherwise also we suffer anxiety. Many of us suffer anxiety. So that is another very important symptom if we talk about mental illness or mental well-being. So I think these few are the major ones. And if you feel that um, you're having any of these symptoms, you should definitely immediately try to contact your near ones, and even try to contact your specialist as much as possible to take care of it early.
Right.
So that's how mental illness is defined as.
Yes. So another question which comes up right now is, there are so many people who are scared to, express their, that I have a mental health. They think that it's a mental problem. So what is the difference between a mental problem where, like, they think that, okay, maybe I'm mad, that's why I'm having these issues. So, what suggestions do you have for these kind of people who mix up mental health with the mental illness? Both of them are different as far as I know.
Right, right. So mental health is, something which is normal. Mental health is for everyone. Everyone requires a good mental health. But mental illness is something which is not, it's like a disease for the body. So when you're not in the good state, that is actually mental illness. And mental health means you think in the right direction, you think positively, you think without anxiety, you work without anxiety. So that is mental health. So I think there's a very thin line difference, but mental health, if we take in the bigger picture, mental health is for everyone, for one and all. It is there. It is mandatory to lead a good and a normal life. And mental illness is when that mental health gets disturbed. So that's how we differentiate both these things.
Yes. You started with the sentence that, the pandemic won't spare people the way that we are expecting it to be. It will be there will be so many people who will be suffering from mental health as well. So what are those signs or issues that you think the people will be suffering from post pandemic?
Right, right. So that was something I really wanted to talk about today. So, like we have all spent a very active social life before this COVID-19 era. But now, since this pandemic, things have totally changed. The way we interact is actually causing a digital impact on all of us. And one of the very first candidate, as a sign or as a complication of this impact of COVID-19, I would call would be something which is called as obsessive compulsive disorder, which is called as OCD, in short. So this OCD is something when you have a compulsion to or an urge to do something repeatedly, and that's actually a mental barrier or a mental illness, you can say, which is faced by a few people in society. Some of the people are suffering from it already, and but because of certain behaviors that pandemic made us to do forcefully, such as having hygiene, sanitizing our hands regularly, washing our hands, keeping cleanliness around us. So doing this repeatedly, people are becoming prone to OCD. So they're doing it so often that actually it has become a mental illness, and which is not right. So this is one of the sure complications that this COVID-19 has given us, and especially for those who had this previously also before this pandemic era, for them it would be even more exaggerated. They'll be even more impacted due to this. So that is one complication that we are going to face. We are already facing it, and another thing that we would be facing would be general anxiety. So anxiety, we know, is very common in our common day-to-day lives. Also, even if we don't have pandemic, we know people do get anxiety. But due to this pandemic, anxiety issues have also increased a lot. So people are becoming over anxious day by day. They're becoming short tempered. They've lost their patience. So that's all the signs of anxiety. So that's the second complication. And the third complication that we have is known as chronic loneliness. Now, we know that we have all faced this lockdown thing today for the past few months, and some people, the special population who are restricted to go outside their homes, they are even facing that scenario today also. So that has already led to a thing called as loneliness, and it has been there for a few months, so it has become chronic loneliness. Now, this chronic loneliness has, further made other diseases come up, such as depression and anxiety. So that's the third complication, the very common that one which we are seeing. And also because of the lockdown effect, people are staying away. They're not interacting socially. They're not meeting like we used to do it before. So this chronic loneliness has also come up, and now people are even scared to have that social time as the previous time. So I think these few things are the common complications that we are facing now because of this pandemic effect. So we do need to look upon them. If any of these is affecting you, I think you should definitely take steps to just to take care of it and to improve your mental health and well-being.
Yes, talking about it to your near and dear ones, um, sharing your thoughts. These, I think this can be one. What are the other ways you can take care of your mental health if you're suffering from one?
Right, right. So I think the first thing that I would like to tell everyone to take care of their mental health is you should always take things easily. Take it one step at a time. Don't be so much taking all things one together. You cannot do everything together. So you have to be very patient with dealing with your mental issues. And of course, like you said, you need to talk to your near and dear ones, anybody in your family, maybe your friends, whom you can confide, your feelings, and you can share your thoughts and whatever you're feeling, whatever negative is going inside you, inside your mind, you can just try sharing with other people. Another thing that you could is you can approach a specialist, maybe a psychotherapist or a psychologist to help you out with your mental issues is what you can do. And also, having a healthy lifestyle is very important because having a lockdown period has totally changed the way we live. Our lifestyles have been affected so much. People have been affected physically. Some have gained a lot of weight due to odd lifestyles that we all face and working from home. So all these factors is the main factor that takes care of it is having a very good, healthy, and normal lifestyle, which means sleeping at proper times and eating at proper times is, what all healthy lifestyle is all about. And it also affects your mental health, not just physical health, but also mental health. So I think that's one thing which everybody of us can do and we should do it. And of course, apart from that, having some time to spend with your family and loved ones, not being very isolated, and of course, quarantine has also, created a negative impact on so many of us. So try going back to your normal life in your family, having a conversation with your family members or friends, as much as possible. So these are the few things that you can take as steps to take care of your mental well-being.
So there are people who I have been talking to recently, and they were telling me that they are suffering from depression, but they have this thought in their mind that they can never come out of it. They can not get completely get rid of the mental health issues that they are suffering from. What do you think? Is it something that can be cured, or something that can only be reduced down to a particular level?
Yes, like I said in the beginning, very few unfortunate of us would be there who would not be having the normal life again after this pandemic is over. So, of course, but then, as they say, nothing is impossible. So we do need to take one step at a time. And depression is, of course, a very huge mental illness for anyone. But if you take one step at a time, following the right advice, to a specialist and taking care of the small daily activities that you need to do. So I think you can come out of depression also. It would take time, but yes, nothing, like they say, is impossible. So you do need to make efforts towards it. And the first effort, I think, would be having a positive mindset, trying to be, surrounding yourself with positive people and having this sense of gratitude that, you are alive even after this such a huge pandemic that we all face. You're alive, you're near and your ones, they are fine, and you're having a normal life. So that itself is a boost to your mental health.
Absolutely, absolutely. The most important takeaway is this is not a possible task to do. You can get rid of it. You can eat. All you have to do is to stay positive and
Right,
talk about it, share it with people. So,
right.
anything else that you want to add on to this topic that we have today on mental health? Anything else apart from the questions that I had?
I think, yeah, one thing I could suggest everyone to do is to try to, maybe spend few minutes to realize what this pandemic taught you. And of course, everyone has had a lesson to learn from this, maybe in your personal life, maybe in your work life. So there could be anything, but of course, there has been positive results and positive impacts for all of us. We just need to look at that positive side of pandemic and get back to our normal lives and learn. And of course, this pandemic is there to teach us. So just try to know what it taught us and what need to learn from it and correct ourselves where we might have been going wrong for all these years. So we just need to look on that and learn from it and take our lives more seriously and try to correct our mistakes. So that's what I would like to all of us to reflect back on yourselves.
Thank you, Dr. Ankita. It was such an insightful discussion that we just had. I always wanted to talk to someone about this topic, and you gave us such a positive outlook towards such a big issue that is there. More
Right,
than the pandemic, I think the mental health is another pandemic that we have been suffering from a long, long time, but we don't give much importance to it. So it was really
definitely.
nice talking to you, to have you on our floor, and such a
Thank you so
positive
much. Thank
such a positive discussion and chat we had. In case if any one of our viewers have any issues, how can they reach out to you if there are any?
Yes, so I think you can reach us out through our Instagram page that we have with the name of Talk Physio, and you can also let us know through our Gmail address talkphysio@gmail.com. You can send in your queries or whatever doubts that you want to discuss with us or anything in particular. So you can just reach out us through these platforms and let us know how can we help you.
Thank you so much, ma'am. So here we end today's discussion. I hope everybody who is watching us will find this video much more productive and will get something out of it to deal with the depression or the anxiety that they are suffering from. In If you have any queries, ma'am just gave you the means to communicate with her. And thank you so much. Thank you so much, Ankita Luthra, ma'am.
Thank you. Thanks a lot, the NTT team, and thank you, Sapita, for this time in the interview. Thank you today.